times that we're in. So I'm Tasha de Kock. I'm an audiologist and the project lead at the hearX group. And today I'll share a little bit with you about our journey. So hearX is a disruptive medtech scale-up company that has the vision and mission to develop and implement and scale sustainable hearing services using digital technologies that anyone can use everywhere, anywhere. And this has really been our strive over the past couple of years. And at the moment with ATIF, we are trying to see how we can take this even one step further. To date, our technology has reached more than 1.5 million people, and it's also been used, our clinical solutions, in more than 86 countries worldwide already. But still, to this day, the need just remains huge in terms of hearing health. And the WHO released earlier this year the World Report on Hearing that shows us that 1.5 billion people currently is experiencing some degree of hearing loss. And unfortunately, we know that more than 80% of these people live in low and middle income countries where the access to services are really, really low. Close to non-existent or very low. If we take Africa as an example, we know that there's only one audiologist for every million people on the continent. So I don't even have to say more to explain the need when it comes to hearing health. So if we move on to the next slide, I'll show you what we've been trying to do in this ATIF project. We have been working on creating an innovative and sustainable access to end-to-end hearing health services in low and middle income communities. And I'll explain a little bit more. So up to recently, our hearX technology focused on the screening component or the detection component in the hearing health journey, as well as the diagnostic component of the hearing health journey. But we realized the need in low and middle income context to be able to offer an end-to-end hearing health care model. And you'll see there that the model that we wanted to work on and explore together with ATIF has 5 steps to it. So firstly, we know we need detection of hearing loss, first for the person to become aware of that. Then we need to diagnose it. And then we wanted to add in an extra step in this model because we know that awareness is so low in these contexts. If you've never heard of a hearing test or hearing aids, that you often don't even know what it can do for you, that we can create that desire to address it. So we wanted to build in a step into our model where we can give somebody the opportunity to have a demonstration of what amplification can do for them. Then in the treatment component, we wanted to look at innovative financing options and how we could make that accessible and sustainable. And then finally, to also innovate in the space of support, because we often know that even if somebody gets a hearing aid, it often ends up in the drawer, because we know how important that first 6 weeks after the fitting is, and to really be able to adapt to the new technology. It's not just a get it and all of a sudden everything is fine. It's really an adaptation process. And so there we also wanted to innovate in a contextually appropriate support method. And I'll tell you about that a little bit in the next slide. So during the last 9 months, we have worked in 2 phases to firstly build evidence for this model. So for some of the components, we had a lot of evidence that we've already researched and clinically proven, but we wanted to make sure we also fill in the gaps. And we started off with a pilot period in South Africa to test some of those other components where we could be close. And importantly, we wanted to see if it was possible to actually facilitate all 5 of these steps through the help of community health workers or non-professionals that's guided through the technology and through the audiology realm. So importantly, first, we wanted to look, for instance, what effect that demonstration the addition of the demonstration would have, and we wanted to also test out the fitting of hearing technology in the home together with the support program. And our learnings has been great. We saw that it was extremely special for people to have an opportunity to just experience hearing technology. So after the test, we would give them an opportunity to, we would program the hearing aids according to their need, and then give them an opportunity to just hear how it sounds. And I must say, personally, those feedback and just seeing the people's faces was truly special. And the one woman, for instance, after fitting it, just said, it's as if I can see for the first time in my life. So that really showed us that it's wonderful to be able to give that a demonstration of what benefit they could get to them, and how that could also facilitate buy-in into the process. Then we also saw that it's definitely possible for a non-professional to facilitate this process from end to end, so from detection to support. And then lastly, we had great learnings with the support program, where we actually developed a mouth supported support program that we facilitated via WhatsApp, and we could send them a message every day for the first 6 weeks that had a little picture to give them that day's tip of the day, together with the text in writing, and then we also sent it via a voice note. And the feedback on that was fantastic. We also made sure that we test all of this. And especially something that I can mention is we used the international outcomes inventory for hearing aids before fitting them, 6 weeks after the fitting, and again repeated that 6 months later. And I'm very happy to report that the findings showed a significant increase pre and 6 weeks post, but also the participants maintained their score 6 months post fitting. So very exciting to see that even in this whole process that's facilitated in the home, that we could still achieve outcomes measures for hearing aids similar to, and on par with international scores and scores that we would achieve in first world countries. So the next, we moved over with our focus to Kenya. Sorry, I'm just still on the previous slide. And in Kenya, we started with our venture building support through the team. And I must say that that's been the highlight so far. We first dived into feasibility studies, and together with the ATIF team, we came up with 3 different models that could be paths to the market, and conducted studies for all 3 models. So one, we explored working with a pay-go solar company and to see how one could implement in that way. And the second one we explored was working with a pharmaceutical distribution company. And the third one, we tried to look at innovative ways of working through corporate partnerships to go to market. And our learnings has been great, and it really informed our decision making towards the end for operationalizing. We also had the great privilege of working with expert consultations. One that I particularly enjoyed was working on communications and marketing strategies that's contextualized for Kenya, and how we could adapt to the context. Another one was working on business and financial modeling to really see how we can strive for a sustainable model that can really bring sustainable change in this sector. And lastly, we were working with our expert team on operationalization and launch prep to get ready for testing our first component. And so in the feasibility studies, we learned a lot. For instance, one of the things we learned is that even though we wanted to go with a WhatsApp-based support program, we saw that the uptake of WhatsApp was still lower than expected. And many of our potential customers will still be using basic phones. So we would have to adapt in terms of facilitating via SMS, for instance. And other interesting factors was also learning about what our potential customers see as affordable, what they think hearing aids costs, and what they would be willing to put towards getting access to a hearing aid, for instance. We definitely saw that awareness is low, so we're going to have to work on that. Trust is a big issue. So in many of the questionnaires, we found that people still will have to deal with a level of trust. They're sometimes used to hearing aids being brought into a country, donated, and not well supported after that, and that we would have to address that. I'm going to move on to the next slide. So I'm very excited to share some of our key accomplishments to date with you. It's been a busy couple of months. So first of all, we managed to register the company in Kenya, which was a process in itself. And also one of our key learnings that when going to a new market, this should really be your first step in the first month. It can be a daunting process, but once again, that's where ATIF has been super helpful, having somebody support us in country, knowing who we could contact, and in that way we could get the final result. Another key accomplishment was our app that we built to be able to facilitate this process, specifically in Kenya, according to the model with all the learnings we've had. And then we've also managed to get a committed partner for the first launch and pilot that we will be running. I'll share a little bit more in the next screen about that. And then we've interviewed and spoken to 450 people in Kenya to really make sure we know our potential customers, what their needs are, and what also the risks are that we need to look out for. We've fitted 19 community members with hearing aids, and we're able to conduct all these studies that I shared with you a little bit. And then also one of our key accomplishments was this new support program that we developed for the model. Next up. So what's next for us? Moving into the final stretch. So we've been able to partner, very excited to share that we've been able to partner with Elara Health as our first strategy to go to market. And it's actually just a beautiful tale of two companies that actually they were looking for us and we were looking for them and found one another at the perfect time. And they've agreed to work with us for the first pilot to launch into 6 of their clinics in 2 locations within Kenya. And we are very excited to kick that off in December. And we will also be looking at M-Pesa integration to allow for monthly payments to really work on that affordability and on some creative financing options to make this affordable to the market. Thank you very much.